My journey in our industry began at the front desk of a doctor's office. I became a biller and years later founded a medical billing company. After selling my business in 2015, I've turned my attention to sharing what I've learned with others. This is Leaders in Medical Billing, and I am Chanie Gluck. Together we'll learn from leaders in our industry, explore challenges, and discover specific takeaways that you can use in your business. This show is sponsored by 4D Global, empowering medical billing companies to grow through offshore staffing. I am excited to have Paula Hall with us today. Paula has so many initials after her name that I can't even begin to start, but I want to share with you that Paula is a healthcare professional who spent the first 15 years in clinical and then 30 years managing administration at hospitals, clinic and surgical centers across the US and globally. Paula started her global career in the late 90s and is currently a highly qualified healthcare management consultant and advisor. She holds a vast amount of credentials, including clinical documentation improvement, specialist and trainer. She's trained over 250 physicians in CDI, which is clinical documentation improvement, and now offers in-person online CDI training, assessments, and audits. Paula has led and managed training developments across the US, India, Philippines, Africa, South America, UAE, and beyond. Her work has consistently delivered transformative results, making her a trusted authority in shaping and optimizing healthcare organizations to meet the ever-evolving demands of the modern healthcare delivery. Paula's leadership ensures that operational challenges are met with innovation solutions, driving efficiency and sustainable growth, while always prioritizing the quality of patient care. A hallmark of Paula's career is her ability to recognize and address the unique challenges faced by healthcare organizations across diverse regions. She's currently working in the Middle East. Welcome, Paula. Good to see you.
Well, it's such a pleasure to be here, and thank you so much for having me. Super excited.
I'm excited to have you too. You know, you and I have had a number of conversations before this one, and I want you to just give us a brief background of how you born and raised where in.
Well, I'm born in the USA, grew up
Okay.
in Houston, Texas. Yes.
Okay.
And from, I guess, the time I was, I think 4 or 5 years old, I wanted to be a doctor. That was my main goal. And unfortunately, of course, with costs and all of that, I wasn't able to make it all the way through to becoming an MD, but I leveraged in nursing as a nurse in the USA working in the Texas Medical Center. So, as you mentioned before from my bio, I spent about 15 years in nursing. Then I decided I wanted to leverage into where managed care was actually coming into play at that time. And I wanted to get into medical billing and coding. I learned collections, basically started from the ground. And instead of myself going and working for one entity and just being with a particular company for the next 10, 15 years, I decided I wanted to learn multiple systems, multiple processes. So I decided I wanted to float around and work with different temp agencies, which leveraged me into consulting firms. So gathering all of that experience opened me up to the global market, which is kind of where I am now. But I started in India. I was on the very first outsourced project to India. Now, I thought when they called me, I thought they said Indiana, but they were telling me I needed a passport. So I'm like, why would I need a passport to Indiana? I've been to 48 states here. Come on. They're like, no, you're going to India. I'm like, oh, wow. So started from India, was in Philippines, West Africa, Dominican Republic, now Middle East, and just ready to go wherever. I love the travel part of this. And I'm blessed to say that my level of experience has enabled me to be able to go to different parts of the world and be able to provide the knowledge and expertise that I've been granted. So I'm very thankful for that. So not only revenue cycle management, I'm also working with transitioning healthcare facilities. Also, a big chunk is training and development because nothing gets done unless the staff is ready to make it happen. So these are the areas that I'm really, really focused on now, and not looking to stop, looking to keep going. Healthcare is ever evolving. I'm evolving with it, hopefully, inshallah.
Love it. I love your spirit being
Thank
able to
you.
just pick up and go to all these countries. But I want to hear more about what was your first trip to India like, and what were you tasked to do on that trip?
Oh, that was amazing. I was super excited because it was the first time, I mean, traveling throughout the USA, yeah, I got used to that. But the first time going outside of the country, I mean, really, that was just super exciting. So I was actually hired over the phone. Bearing Point was in charge of this particular outsource project. I won't go into the client name and stuff because I might not be allowed to give too much detail about that. But let's just say it was a massive, massive project, and it was the very first project to be outsourced overseas. So of course, I did get a lot of backlash for that because back in those days, that was very taboo. You were not going to send our info. But what I explained and what was explained to me was that when you're so behind, when you have such a huge backlog, it is more cost effective to send some of the tedious tasks. That way, we in USA are able to catch up and manage our day to day. So, not realizing how long that flight was going to be, we're talking 22 hours. I'll
Oh yeah.
never forget it. Yes, with 5 over layover in Germany, which was great.
Yeah.
But arriving there, oh, it was so amazing. I mean, just seeing all these beautiful people of India, and they're all looking at me in awe, and I'm looking at them in awe, and it was just amazing. So getting to the work area was really, really exciting. And I'll be honest, I had a staff of almost 500 people. So I had 3 floors. And one of my main things is, and I even hold myself to this currently, is to make sure I get connected with my staff. I don't look at myself as being above anyone ever. I can't do the job of 500 people. And in order for me to be a proper leader, I'm going to have to learn how to follow as well. So I needed to get to know my staff. And I did. I would do all types of functions for them, parties. One of their main things that they loved chocolate from the USA. So I would
Yes,
have,
yes.
yes, I'd have one box delivered. My sister would send me a care package. So I have one box delivered once a month so we could all have our day of chocolate. Almost 500 people. That's a lot of chocolate.
Oh
But we
yeah.
made it, we made it happen. So of course we had ups and downs, back in those days, the infrastructure sometimes was failing. Technology wasn't all the way up to par. We were still using SAP at the time, believe it or not. So, I'm talking way back
Yeah.
in the day. But we got through it. We actually had a window of 32 million to bring back into the facility. And we leveraged with 56 million. I take no
Wow.
credit whatsoever. I give it all to the staff. But I'm happy that I was able to bridge the gap between my being from US, their being from India, and just kind of coming together for one common goal. So I'm still super excited that I was able to pull that off
So, so
with the team.
what year was that?
Well, this was in 2003. We
Okay.
started out in 1998 was when everything was kind of coming together, but it did not work. We failed miserably. But in 2003 we were able to get things up and running and moving. Now, mind you, I was only supposed to be there for like 3 months because we would rotate, okay? But
Mhm.
the team actually did some type of call with the staff and with the owners back in the US and basically was like, we're doing really well. Why can't we just keep Paula here? And I'm like, well, I'll stay if you'll have me, sure. So I ended up being there for like a year and 9 months for that particular project. After the success of the project, then I started getting other entities in India, business owners, investors that wanted to set up healthcare divisions for outsourcing in their facilities. So I ended up being there almost 8 years.
Wow.
Yeah,
What,
I know,
and
right?
that's a long time. What city were you
Yeah.
in?
I was originally in Chennai, but then I traveled all over Hyderabad, Bangalore, Delhi, Karnataka. I don't think there's a city I haven't been to. I was even in Indore. Indore, I went actually like maybe about 5 years after I originally left because they needed some medical billing and coding training. They needed to kind of recertify some AAPC. So they called me to come and do that. I had never been to Indore. That's like far up north. And it was amazing because at the time I had braids. So nobody really spoke a lot of English, but they would come up and touch my braids.
Love
Oh, it
it.
was amazing. I loved it. I did. I did. I still get calls to come back to India occasionally. I was just there actually this past summer in Mumbai, and then I went to Pune. So there's a lot going on always in India. I mean, we have some of the brightest minds and some of the most amazing work ethics. That's what I love the most. Is the
Yes.
work at work. They made me level up with my work ethic.
I could see.
So that was
Yes,
amazing.
very true. The work ethic and the respect is really cool.
Oh,
What was it like as an American? You know, you're a girl from Texas
yeah.
living in India. What was that like? How did you make friends? Like, tell us about that.
Well, I'm always maybe a little bit ambitious and maybe a little bit daring. Most we were all kept on like a little compound, okay? Paula is not to be kept. I mean, just, away from everyone. I didn't feel any danger or anything like that. And I was always safe. I mean, I paid attention. I'm from the States. Of course, I
Yeah.
did. I know how to look over my shoulder. But I just didn't feel that way. So I got out. I did, not without violating the rules of the company, of course, but on my own time, just kind of going to the little malls and people automatically walk up to you, hi, and you're smiling back at them. I mean, of course, be welcoming. Don't look like you're looking through them or your nose is in the air. No. First of all, when I come to your country, I want to know how it is to be in your country. My American was left in America. Coming to adapt and adopt to your values, your culture, and I want to learn. So my brain's like a sponge. I'm trying to absorb it all. So I never had problems meeting people, talking to people. Maybe a little bit of accent training might have needed to take place a little bit, but we have, honey, I use my hands. We do a lot of sign language, and I tell you, I still have people that are asking me even to come here to the Middle East to work with me. Now that makes my day every day, that people are still interested. They still remember from way back then. They've gone on to have families of their own. Some of them are even in the US now doing multiple works. But it's amazing that, people, they remember, because it's about treating everyone like you want to be treated. I don't care what part of the world they're from. We're all human beings. We're all on earth for a purpose. So why would I ever think that I'm better than you? In what way? I'm
Yeah.
just not that type of person. So I got along just amazingly. And I took that same energy with me to the Philippines, Dominican Republic, West Africa. I can't say that there is a country I would not be welcomed back into. I always try to keep a good rapport with people and a good sound reputation and keep my integrity intact. no matter, I don't care about the money. I need my reputation. You can't purchase those. So, well, maybe these days, I think AI allows you to. I don't know. But I'm not that person. I want it to be authentic. So I'm very thankful for that. I take none of this for granted.
Okay, so now you're living in Dubai. What made you decide to settle in Dubai? What are you up to in
Well,
Dubai?
I didn't, honestly. I'll be really honest with you. I did not choose any of the countries I've been to, and I've been to 24. I was always contacted by way either of LinkedIn or some job board or word of mouth or whatever the case might be. Excuse me. So I've been very blessed in that area that people will look at my profile and think, oh wow, she's been here, she's been there, she must know what she's doing. Because believe me, if I didn't, nobody would be calling. So I was actually in Goa at the time, in India again. India's
Yeah.
like home, seriously. And I started getting LinkedIn requests from the UAE, from an actual medical billing and coding company that was here at that time. This is back in 2010, I want to say. And I'm like, no way, this is a scam. I didn't answer them for like 5 months. And they were talking about revenue cycle. I'm like, okay, wait a minute. These guys are still chasing me. Let me see what's going on. So
Right.
back in the day, I mean, of course, we had Skype. So there was no Zoom. So they asked for a Skype call, and I'm like, okay, let me just see how far this is gonna go. I mean, it's the Middle East. They're not doing any revenue cycle there. Well, guess what? I had to eat those words. They were
Mhm.
in full swing of revenue cycle. So after about four video calls through Skype, they said, well, we're going to send you a ticket. We're going to send you X amount to come over so you'll be taken care of. We'll have a car to pick you up at the airport. Paula loves that. I love the attention. And, and I tell you what, they did. I mean, within an hour, there was like money in my account. And I'm like, wait a minute. That's a little scary because it usually takes a couple days. Nope, I don't know what they did, but they made it happen. And then I had an e-ticket and I got on the plane and I got to the airport. And as I'm in the car going through the city, I'm like, oh my God, I think I'm home. And
Mhm.
it was nowhere where it is today, but it was still the most amazing country I mean I had ever seen. I mean, just absolutely beautiful. And I'm like, wow, I think I'm gonna like this. So I did, and I was actually called in to be interim COO. And I was offered a position, but I'll be honest, I when I got here, I saw I mean, I felt like, okay, I'm a commodity here, a rare one at that. Oh, there's tons of Paulas now, but back then there was no Paulas. I'm like, oh no, that's okay. I'm gonna not take this position. I'm going to explore, and I did. I started getting calls from Saudi, from Kuwait, Oman, Qatar. I've been all throughout the GCC. Very blessed, very blessed. And so I've leveraged mostly in revenue cycles, setting up RCM departments. Now, as actually currently, I'm working on just put forth an online CDI course, clinical documentation improvement, because we do lack in that area. But like I tell everyone here, we're not the only ones. We're still lacking in that area, even in USA. I don't care how much software and AI you put in, patients are individuals, and we have to be able to feed the information into a system or into AI. And we have to look at better quality of care and better patient outcomes. And we're not doing well in that area. Also, that's most important, but we also are looking at the healthcare facilities not being compensated or not being fully reimbursed for what they're doing. I mean, that's just not good. And it's all because of clinical documentation. I mean, insurance companies, bless them, they're there to do a job. It's their job to find deficiencies and not have to pay. But they're trained for that. I know because I used to work for several as well. Well, I wanted to be well-rounded. So I figured if I'm going to learn it, I'm going to learn every little aspect of it. So it's our job, though, as healthcare providers to explain in detail everything that we are doing with that particular patient for whatever illness they're appearing for. So I put together a course online. We can do it in America. We can do it all over the world. I've also gone through an international accreditation to provide continuing medical units, CMEs actually, continuing
Mhm.
medical education. I got 5 of them. I got those from the UK. I'm making it all international because my trainer's from the USA. I'm from the USA, the owner, but my trainer is Miss Tony Park. She's absolutely amazing. So she did all of the videos. She has like 6 credentials in CDI. It doesn't get any better than that. And then I have my business partner in UK, Mr. Nathan Nagel, who set up the whole platform. And so, because I didn't want it to be convoluted, I wanted to be, you log in, here's your videos, here's some quizzes in between, here's the final exam. You also get a certificate of attendance along with a certificate of completion for the basic course. It's only basic. I didn't do anything on specialties. I want to see how basic goes. Then I'll start writing content for these specialties.
So who is this course for? This online course on clinical documentation? Is it for providers, for nurses? Who is it for?
Actually, it's physicians, nurses, medical coders, everyone that's involved with that medical record and putting in any type of documentation. I say, take this course, at least get a better understanding. If you don't want to go any further than that, no problem. Just whatever it takes for you to manage your day-to-day duties, get as much knowledge as you need. That's why I have so many credentials. I have 63. No, I don't put those all on a card because they won't fit. But I'm hungry for education. If I'm going to be in this industry, in this field, healthcare is like a tree. There's multiple branches. And I'm not hands-on patient care anymore, but I'm familiar with it. And now I want to assist the providers and let them know I've walked the same walk you have, from trauma to ER to I was a helicopter nurse for a short time, very short time. That's a whole nother story. We do not have the time to talk about that. But I've worked in those different specialties from neurology to podiatry. So I'm able to help our physicians because the thing is we can't allow them to do everything. There's not enough time in the day. Let's assist them. Let's get them what they need. Let's get our nurses involved more. So there's not so many queries coming to the physician. So that's why I developed this course. We needed it, and it's very inexpensive. I'm not here to just try to make $1 million. I don't care about that. But if I can leave a legacy, leave something where people are like, you know what? I want to take that Paula Hall course. That's good enough for me.
Right. Well, I think that's great because we all know that documentation is the key to proper reimbursement. And the better our note is, the better our outcomes of getting paid. And, when medical record requests happen and there's inadequate notes, then of course the insurance company doesn't pay the way they're supposed to. So I think clinical documentation is really important. I'm so glad you decided to launch this course because I think we need it. Like, it's definitely necessary.
Yes.
Coders don't really get trained on what a proper note looks like. They're just trained to look for the, try to find the diagnosis but this is, I'm glad you did it. Okay, let's talk
Thank
about
you.
let's just switch gears and talk about
Sure.
what are some emerging challenges that you see? I mean, obviously we talked about the documentation piece of it, but anything that you're seeing, I know you've worked in the US and then you're now working in the Middle East. Are there differences in the Middle East versus the US? And what challenges do you see, if any?
Absolutely. Yes, yes, yes. One thing about me, I'm going to be honest. I work in this every day and I see it for myself. And look, we all have challenges. We all have, it's not about the country. We're all, I believe, doing the very best that we can with what we have. Now, there are differences. Like, for instance, USA, we have Medicare, Medicaid. We don't have that here. We have HCC codes there, APC codes. We don't have that here. We have DRGs, we have HPICs. So there's a lot of differences. Even in the UAE, we have differences in Dubai as opposed to Abu Dhabi. Okay. So learning, and the thing is, in the USA, we have the OIG, which is the Inspector General for Insurance. We don't have that here. So it can be very, very different. So learning how to read your contracts and negotiate your contracts with insurance companies is a necessity for here, but not everyone, of course, does that. Sometimes, things slip through the cracks. It is what it is. Also, writing off it's a real pet peeve of mine. I refuse to write off one nickel. That's just not who I am. I want it all. But because you add that up over a year, how much money have you lost? Thank you.
Oh, yeah.
So I think a lot of times we don't do that here. A lot of facilities won't. And it's a little bit different, the mindset, I would say. It's like, no, let's just move on, that's just a little bit of money. We'll write that off. We're going to lose more money if we go after it. So there are differences there. There's also differences even in the medical coding. We're on CPT in Dubai, PCS in Abu Dhabi. Saudi is on an Australian methodology for medical coding. I actually went to learn that one as well. I didn't get licensed because it's just convoluted. I don't like it, don't want to do it, but I will. Don't want to make my Saudi and Qatari people mad, but I do it. That's why I went to get the training. But it's just different from place to place. But our focus, one thing I can say is definitely here in the UAE, Qatar, and Saudi, if I can name those three, they are not shy to put funding in healthcare. And the focus that I've seen, let's say from the time I arrived to today, oh my goodness. I mean, we're branching into robotics, which is another, I think I sent you guys a link. I want to showcase that as well because we're on the way. We are definitely on the way. AI is being implemented. Dubai Health Authority, I have to say, these guys are amazing. They're kind of like our governing body, and they are really, really focused. We have what I call our new school Arabian mentality. Most of these amazing guys have gone to Canada, Germany, UK, US for their education. So they're coming back home and leveraging their country. And I love it. I'm loving it all the way. So they want to know, they want the knowledge, they want to see their country flourish, and they have the funding to make it happen. And I used to see where it would take a long time to get things organized and get things done. Not anymore. I'm just watching, I'm sitting back watching it evolve. While we're building the tallest buildings in the world, we are really getting focused on this healthcare sector. Like right now, we have Arab Health going on. It's amazing. I've never seen so much robotic and AI. I swear it's really going bananas. It's amazing. And in fact, we're actually going to be doing an event pretty soon that I'm definitely bringing you over for. We're working on it now with my business partner, Joe, who is, what I've done is I've merged my company so I'm able to do events and media. We're doing TV shows. We got a lot going on right now. So Pinnacle MENA is the name of that company. And I'm Pinnacle MENA Health and Innovation Plus. So we're just coming together, mixing it up. The more, the merrier. No one can build the whole kingdom by themselves. Let's all come together, brick by brick, and build something amazing that we can all be proud of. So,
okay, you talked about fantastic. You talked about AI and robotics, that Dubai is really on the cutting edge of that.
Yeah.
Is that on the billing side, on the healthcare delivery side? Like, where are you seeing it? And share with us what they're doing that we may not be doing.
Absolutely. One thing, and I've been doing a lot of research lately on the insurance side, It will be covered, I would say, in the very near future, but it has to show where it's cost effective. I mean, we're talking robotic surgery. That's not going to be cheap. So we're going to have to actually really come together and figure out how is this going to be cost effective? How is this going to leverage the patients? I mean, if we can show that, let's say, a surgery will take this short amount of time, the patient will be comfortable, the amount of time that they're having to be admitted into the hospital will be cut in half. If we can show all of those things, and we will eventually, right now, I believe that it's mostly being talked about, and the facilities are ramping up, but I don't believe we're quite there yet from my perspective. Now, someone else might say something different, but from what I've seen, this is all new, but we're getting there.
Okay, great. And what kind of technology are you seeing on the medical billing side, if any? Like, are any technologies being used?
Well, I would say there are different types of softwares. I know we've adopted Epic in a few facilities, and actually, from my understanding, and I heard this through the grapevine, I didn't get a chance to actually verify it. Even in Saudi, there's going to be some transitioning, and Epic is going to be coming on board. We're usually a few years behind the USA when it comes to technology, as far as medical billing and coding and all these things. And that's okay. I mean, long as we catch up, right? So we're getting there. I won't say, one thing I will say though is we're not necessarily all on the same page. I'd like to see a more uniform type software systems. I know we're working on that when it comes to identifying patients with the insurance companies and ensuring that patients are not going to 5 different facilities in one day. So we are unifying that, but one day at a time. We're getting.
How many insurance companies, for those that are not familiar with the healthcare system in Dubai, are there a lot of different insurance companies, private insurance companies that you bill? Because we know that in in Dubai, there's no socialized medicine, right? So you got to bill the insurance
Right.
company. So
Absolutely.
what are
Or
we
it's
dealing?
self-pay.
Right.
Sorry.
So what are we dealing with as far as insurance companies?
Yes, we do have quite a few. And usually any healthcare facility will go through what's called an empanelment process. Like we go through a credentialing process with our insurance companies in the US. It's an empanelment process, kind of the same information, but each insurance company literally has its own kind of rules and regs that it follows. And I believe DHA is also working on kind of getting that in a uniform process as well. But I won't speak too much about that because I'm not real sure. Because we've been talking about it for a few years, but we're not there yet. But so there's a whole process that a healthcare entity will go through. They will literally choose which insurance companies they want to, deal with based on how quickly it's paid or, what relationship. I tell you, our region here is really based a lot on relationships. So we try to get those established and then we're able to get through things a lot quicker. I think we have probably, I mean, we got new insurance companies coming up all the time, but I think we have about close to 80 to 100 right now.
Wow.
Before we only had like, I think when I was here, when I first came, it was only like 30. It was, I mean, very little. But hey, we got many, many coming, but we need them because we have so many healthcare facilities coming up. Dubai is expanding big time. So we're going to need insurance companies to cover all of the people, whether and local people, of course, are taken care of. They might want insurance, but the government takes care of the locals, which is an amazing. I love how how the government supports its people. I think that's the way it's supposed to be. Okay. But excuse me, if they want extra coverage, uh, then of course they have the option to purchase additional policies for their families, children, all those different things. So it's pretty wide open with that.
So they take really good care of their people. What's it like for the people, like the Americans that decide to live in Dubai? Do they have to purchase insurance on their own?
Absolutely. Either that or if you're working for an entity, it's their job to purchase it for you. It's mandatory now. Since COVID, it is mandatory that everyone have insurance here now. In fact, I went through something like that myself. I was in between companies and then I got sick. And yeah, so I'm coughing up quite a bit of money for an actual hospital bill. But hey, it is what it is. It could have happened anywhere. So, but yeah, you definitely have the option as an Emirati if you want to purchase extra, but expats must have insurance or we're self-paying. That's
Right.
it. And you can't predict illness. I mean, if something happens to you, an accident, whatever, when you go to the hospital, you can best believe that bill is you will be getting it. Definitely. You'll
Right.
make a down payment before you exit the hospital. Believe me, I know. But
Paula, I could
it's
talk.
okay. It's a way to protect. Yes, go ahead,
I
dear.
could talk. I could talk to you for hours.
Oh,
But
yeah, we
let's
did
talk.
go over, didn't we?
This is my last. This is my last question for you. What does
Sure.
success look like for you? Like, what is like? Talk to me. If we were having a conversation in 3 years from now, where is Paula in 3 years, and what are you doing, and what does success look like?
I'll be honest with you, my dear. I used to set these extreme goals and yeah, I'm sure I could have acquired them all. But I believe in a higher power and I think there's a plan for me. And yeah, I can reach for the stars all day. I'm probably not going to ever reach so. And that's okay because I think you have to be content and you have to love what you do and where you are in life. I hope everybody has goals, okay? And you reach one, you want to set another one, that's fine. But at this age in my life, I'm content. I've done things and I've been to countries that many people can't even pronounce, that I even had to learn how to pronounce. I'm blessed. I don't need fancy cars and big houses. I've been to all those. I've lived in Burj Al Arab. I've lived in Burj Khalifa. I've been places. So at this age, I'm super content. Now, where I'd like to be in 3 years, because I love Dubai, but eventually I have to come home. This is not my country. So when you come here, it's not your country. Come in, do what you need to do, but eventually you will go home. So, well, hopefully. So, I would like to take the knowledge that I've acquired and bring it back to the States because I'm seeing some heartbreaking things with hospitals being shut down and closing because
Yeah.
of revenue. I get Becker's. That's one of my favorites. It gives me the real nitty gritty. So, I want to come back and be able to take the knowledge that I have, work with fabulous people like you to maybe set up something where we're able to save some of those facilities or restructure them or get them where they need to be, find out where the losses were, fix it. I'm a fixer. I'm a research and let me dig in here, audit. I love it. I know it like the back of my hand. Give me that part. And then I can tell you exactly what we need to do to fix it. So these are the main things that I would like to focus on. Absolutely.
Okay. Well, I'm excited to watch this journey with you and
Thank
to
you.
see where this goes in your wild adventures. Paula, where can people find you?
Oh, actually, I sent over my websites and I don't know if you want to list them or I can list them, no
Go-
problem.
Well,
But
are you on
I have
LinkedIn?
my email. I'm on LinkedIn as well, and we have two websites and all of my email addresses. But
Okay, we will link them all in
surely,
the show notes. You got it.
oh, that would be amazing. And also, I want to mention something really quick. I know there are a lot of Americans that want to come here and set up business. Please contact me. No, I'm not after your money. I'm after making sure my fellow Americans are able to come here, set up something prosperous, and be able to leverage it with proper connections, proper business savvy, business plans, feasibility studies, whatever is needed to get you where you need to be. I don't want you to come here and not know where you need to go to get certain things done. Right here. Okay,
Oh,
that's it.
fantastic. Paula, thank you
Thank
so
you.
much. This was such a
Oh,
pleasure.
thank you. I've had a great time and bless you guys. Thank you so much for having me. See you soon.
Thank you.